It's Wellness Wednesday, and today we're talking about how to keep your kids and family healthy during flu and RSV season. Dr. Theresa Horton is a pediatrician with Utica Park Clinic and is here to tell us what we need to know. Dr. Horton, good to see you. Thanks for being here.
Thank you.
So, viruses, they're going around,
yes.
And you know it best. The CDC is saying that this year could be potentially a pretty bad season for RSV, for the flu. What are some of the reasons for that?
So in the southern hemispheres, they have their flu season before we do, and several of the countries are having a higher rate of flu or an earlier flu season, and it is often what is seen there that we will then see in our flu season. The good news on that is our flu vaccine is a good match for what is happening in the southern hemisphere right now.
And so what are the symptoms to look out for? I know that a lot of these symptoms can be similar. You don't know if it's COVID, you don't know if it's the flu, you don't know if it's RSV, so when should parents maybe come see you?
And the respiratory viruses, there are so many of them, and they do all can look alike. What I recommend is that if parents trust their instinct, if they're worried that this is more than just a little cough, congestion, runny nose, if there's high fever, if there's trouble breathing, if a child seems lethargic, then you really should have them seen by their pediatrician.
Okay. New this year, there's an RSV vaccine. We've been talking a lot about it on the news. Who can get that vaccine, and do you guys have it available?
I am very excited that this is even a new thing, because for decades they've been working on trying to come up with something. So there are two things that are new and that it should be coming soon. One is a vaccine that a pregnant woman can get between 32 and 36 weeks, and that will protect their child for about 6 months. The other is a shot that a newborn can have, and it's recommended to be given starting in October. For anybody that's under 8 months, for every infant under 8 months. And then if it's a second flu season or RSV season for someone who's high risk, then they can get a second round. Currently, we do not have it. It was recently approved by the FDA, and it's recommended to start giving it in October, and we're hoping to have it available soon.
And, as a pediatrician, you know about RSV and that.
Yes.
Why should parents really consider getting this? They may be, it's a new vaccine, I don't want to give my kid this, but why should parents be giving their kid an RSV vaccine?
RSV is the #1 cause of hospitalization, especially for infants. And this new vaccine is very exciting because it has an 85% reduction in your risk of needing to be seen by a doctor, or definitely for hospitalization. So your child will probably still get RSV, but it'll be a little cold instead of a pneumonia and days in the hospital, or possibly even in the ICU.
And this is a very basic question, but it's an important one.
Yes.
What can we do to prevent this? I mean, you can't prevent all of it, but what are some ways to keep healthy and keep safe this year?
So vaccination, as we've talked about, for both RSV and flu are very highly recommended, and COVID as well. But the simple common sense things, such as teaching our children to cover their mouth and nose when they cough or sneeze, and to wash their hands frequently, a healthy diet, and some playing outside in the sunshine can also be very helpful.
I love that. All right, Dr. Horton, thanks so much. We appreciate it.
Thank you.
Yeah. So world leaders are addressing climate